A clear overview of heart failure in the United States, including what it is, how common it is, who it affects, and why it matters. What heart failure is. Heart failure (HF) is a chronic condition where the heart doesn't pump enough blood and oxygen to meet the body's needs. It doesn't mean the heart has stopped. Rather, it's weakened or stiff and can't keep up with demand. CDC. Common symptoms. Shortness of breath, especially with activity or when lying down. Fatigue. Weakness. Swelling in feet, legs, ankles, or abdomen. Rapid weight gain due to fluid buildup. Trouble breathing at night. These symptoms often develop gradually and can be mistaken for aging or less serious problems. CDC. How common heart failure is in the USA. Prevalence: how many people have it? About 6.7 million adults aged 20 in the U.S. have heart failure. CDC. The lifetime risk of developing HF has climbed to about 24%. Roughly 1 in 4 U.S. adults will develop HF in their lifetime. HFSA.org 1. Future trends. Prevalence is rising. Projections estimate 8.7 million by 2030, 10.3 million by 2040, 11.4 million by 2050. If current trends continue. HF stats. Deaths and impact. In 2022, HF was a contributing cause in approximately 425,000 deaths in the U.S. HF stats. HF mortality rates have actually increased over the last decade, and the risk of death after diagnosis remains high, especially in older adults. HF stats. Risk by age. Among people 65 and older hospitalized for HF, the 1-year post-discharge mortality rate is around 35%, a serious concern for older adults. HF stats. Who is at higher risk? Heart failure doesn't affect all groups equally. Major risk factors. Coronary artery disease, most common cause. High blood pressure, diabetes, obesity, smoking, and poor lifestyle habits. These conditions damage the heart over time and greatly increase the chance of HF. CDC. Racial and ethnic disparities. Black, American Indian, and Alaskan Native adults have higher HF incidence and mortality rates than many other groups. HFSA.org. Economic burden. HF already costs the U.S. healthcare system tens of billions per year in treatment, hospital care, and lost productivity. Long-term projections suggest total costs could reach up to $858 billion by 2050 if trends continue. HFSA.org. Treatment and management. Heart failure care typically includes medications, ACE inhibitors, beta blockers, diuretics, newer heart failure drugs, lifestyle changes, diet, exercise, weight control, devices or surgery in advanced cases. Better use of guideline-directed medical therapy with the right combination of medications could prevent many hospitalizations and deaths. Summary. Heart failure is a common and growing health problem in the U.S., caused by long-term damage from heart disease and risk factors like hypertension and diabetes, responsible for a large number of deaths and hospitalizations, expected to affect more people over time as the population ages. CDC 1. Subscribe, like, and share for more tips.